Today, the story of how an unproven malaria drug became Donald Trump's coronavirus cure of choice. So, Julia, this might be a really short interview because it's great news, right? We've found a cure for coronavirus.
Oh, don't we all just wish?
And the other thing that we bought a tremendous amount of is the hydroxychloroquine.
When could this miracle cure be ready?
This miracle cure was ready 65 years ago, but unfortunately, it is not a miracle cure.
As you know, it's a great malaria drug. It's worked unbelievably. It's a powerful drug on malaria. And there are signs that it works on this, some very strong signs.
But does it work, Julia?
We honestly just don't know. And anybody who claims otherwise is not really telling the truth.
What do you have to lose? Take it. I really think they should take it.
As questions over his handling of the crisis grow, Donald Trump has suggested Americans take an unproven drug called hydroxychloroquine to treat coronavirus. It is being considered by the World Health Organization as a potential treatment for COVID-19, but they have warned against taking it until there is sufficient evidence that it improves chances of survival. Doing so could have fatal consequences. The hype around hydroxychloroquine has led to a shortage in the US, putting those who need it for other conditions at risk. From The Guardian, I'm Rachel Humphreys. Today in Focus, how did a malaria drug become hailed as a miracle cure for coronavirus? Julia, can you explain what is hydroxychloroquine?
So hydroxychloroquine is a fairly old drug. It's a new version of an even older drug known as chloroquine, which is a drug that was used very effectively to fight malaria.
Julia Carey-Wong is The Guardian's US technology reporter.
Malaria is a parasite. It's not actually all that close to the coronavirus. They're totally different types of bugs that can make you sick. But often when there is a new virus that appears, one of the things that scientists will do will be just to take a lot of the existing drugs and say, let's try this out and see if it has any effect. And they'll just do that in a petri dish in the lab to say, does this work? Does this not work? Is there any hope that this could help us? Because we don't have anything right now that can help patients that are suffering from COVID-19. So in this case, scientists in China and then later in South Korea said, all right, let's give it a try. Take some samples, put some hydroxychloroquine in there and see what happens.
Health authorities say Chinese researchers are looking to see if 3 existing drugs can inhibit the novel coronavirus. Data is now being collected.
What happened was that in the lab, it did show some positive effects. But what has not been shown yet is whether that translates into actual human beings.
And there was also a study in France of hydroxychloroquine.
Right. So a group of infectious disease doctors in France decided to take the next step, which would be to test this on human patients. This is called a clinical trial, and there are a lot of standards that doctors, physicians would normally use when they were running a clinical trial in order to make sure that the experiment actually proves or disproves what we want it to. This is what's called a double-blinded randomized controlled study or controlled trial is the trade language for this. And it involves taking 2 groups of people that are roughly equivalent, giving half of them the drug, giving the other half of them a placebo, and then going through the treatment and seeing, well, did this make people better or did it not make people better?
This trial apparently found that hydroxychloroquine was 100% successful as a treatment for coronavirus. But how on earth did they reach that conclusion?
They started with 42 patients, and those various standards that we just talked about as far as double-blinded and controlled and randomized, basically none of those standards were followed. Half of the patients were in a single hospital in Marseille, And those were all the patients that received the drug, whereas the control were taken from people in other hospitals, which is not really the way that you would design a well-controlled study. The treatment groups, the patients that got the drug, were significantly older than the control group, which is another really confounding variable that makes it harder to understand what's going on. Because the patients who got the drug were in one hospital and the patients who didn't were in different hospitals, that's not a double-blinded study. It means that the doctors knew who got the treatment, and that can introduce its own bias because the doctors might end up even unconsciously treating people differently. Ultimately, what happened is that of those 42 patients, 3 were transferred to the intensive care unit, which means that they must have gotten significantly worse for that to be necessary. 1 died, 1 left the hospital for reasons that are unknown, and 1 stopped taking the drug because they were experiencing bad nausea. The other 36 recovered. And when you looked at the difference between those 36, those who received the drug did recover faster than those who did not receive the drug. And this is how, when the scientists went to report their findings, they said, well, the treatment group did much better than the non-treatment group. But what they left out of that analysis was that the 3 who were transferred to the intensive care unit and the 1 who died, as well as the other 2 who left the study, were all part of the treatment group. By not including those clinical outcomes, they were able to assert that they had this 100% cure rate. But for most people, a very important thing to measure would be, well, did this person get better? Did they get worse? Or did they die? And so in this case, we had a very kind of selective accounting of what the results from the study were. And that then translated into, this really outrageous claim of having a 100% cure rate.
These are controversial results, to say the least. Who conducted this trial?
This study was carried out by a group of physicians led by Didier Raoult. He has kind of put himself out there as a kind of populist figure speaking to the masses about his so-called cure.
L'évolution de l'épidémie.
He has been putting out YouTube videos before he even started the clinical trial. He has amassed a large fan base in France of people who are urging the government to allow them to get access to this drug. He's had hundreds of thousands of people sign an online petition.
And I've just actually Googled him, Julia, while I've been speaking to you, and all of his pictures, he's got very long hair, grey hair and a beard, and he's always wearing a white lab coat. He kind of looks sort of like a medical Jesus.
Yeah, and I think that is kind of how he's presenting himself. He's been on the cover of Paris Match, the magazine. So he's had kind of this rock star media presence.
Okay, Julia, so you've told me about this unreliable, very small study in Marseille that was being run by Didier Raoult, who's a great self-promoter and, has told the world about how successful his study is. But how did that message arrive in America?
There was a very kind of interesting and strange confluence between this French study and a pair of kind of, I don't know how to describe them, but a pair of kind of bizarre hype men who glommed onto the idea of hydroxychloroquine and decided to kind of make it their mission to hype this up in America. These 2 men, one of them is named Gregory Regano. He is a lawyer. He has claimed falsely to be an advisor to Stanford Medical School. He is no such thing. The other one is a man named James Todaro. He has a medical degree, but I do not believe that he's a practicing doctor. He's currently a blockchain investor. And the 2 of them got together and wrote a Google Doc. They formatted it in such a way that it kind of looked like a scientific paper, although again, it didn't really. Basically what it was kind of just a Google Doc that aggregated and cherry-picked all of the potential evidence that could be out there. Somehow, and I'm not 100% sure how this happened, it took off in Silicon Valley. There are a ton of investors and tech people in Silicon Valley that have an interest in biotech and they have knowledge of how statistics work. And I think that those two things combined with a healthy ego have led to a lot of people in the tech industry and around the tech industry thinking that they have more expertise in medicine and immunology than they might actually have. Up until the point that it was actually shared on Twitter by Elon Musk, who is not just influential in Silicon Valley, but really one of the most influential men in the world. And so he has almost 33 million Twitter followers. And that just kind of led to a giant spike in the interest around the country and really around the world in hydroxychloroquine.
After this, how the promise of hydroxychloroquine as a treatment for coronavirus spread from Silicon Valley to the White House. But first, I wanted to thank all of you for your support. In times of global crisis, trusted news is more important than ever, and The Guardian is committed to accurate, reliable news. You can help us to provide the quality information the world needs by supporting The Guardian. Just go to www.theguardian.com/support podcasts. Thank you. Julia, we've talked about how this message that hydroxychloroquine could be a cure for coronavirus travelled from France to America and caused a stir in Silicon Valley. But how did it reach Donald Trump?
After this rush of attention from Elon, very quickly, it also got picked up by Fox News. And on March 18th, Gregory Regano appeared on Fox News show.
Good evening and welcome to Tucker Carlson Tonight,
where he declared the results of the French study, which had actually not even been officially published yet.
As of this morning, a well-controlled, peer-reviewed study carried out by the most eminent infectious disease specialist in the world.
And he said that this drug had a quote-unquote 100% cure rate against coronavirus.
That's remarkable, isn't it, or am I missing something?
That is remarkable. In fact, to be able to cure a virus was said to be mathematically impossible.
That's the biggest news of this moment. Thank you.
Thank you. Please disseminate it to the scientific community immediately.
Over the next couple days, Fox News just hyped hydroxychloroquine like you wouldn't believe.
Exciting news about hydroxychloroquine.
You bet hydroxychloroquine.
And we're going to hydroxychloroquine.
More hydroxychloroquine earlier.
Tell us about hydroxychloroquine and its
hydroxychloroquine is a very safe drug.
And it saved lives.
Media Matters did an analysis. They found that they promoted the drug more than 100 times over the course of 3 days.
Wow, that's a lot.
Yeah. I mean, it's really kind of just astonishing that this became kind of the talking point in the pro-Trump media. And within less than 24 hours from the Gregory Regano segment on Tucker Carlson, Trump himself started talking about this drug in his daily press briefings.
Thank you very much.
And what did he say about it?
I had a very good telephone
He started
conversation.
out being a bit more circumspect, but as days have gone on, he's really started to just wholeheartedly endorse it, saying,
I've seen things that I sort of like, so what do I know? I'm not a doctor. I'm not a doctor, but I have common sense.
why not take it? You have nothing to lose.
It may work and it may not work. I feel good about it. That's all it is, just a feeling. I'm a smart guy.
He's very much been promoting this as the one and only cure that he really talks about.
Try it, if you'd like.
He has a giant bully pulpit. And so when he mentions a drug by name, I mean, just a huge amount of attention has gone to it. And it has just had enormous impacts, around the globe.
He's also tweeted about it, saying it could be one of the biggest game changers in the history of medicine. But what have medical experts said about it since he first raised it?
Medical experts have tended to be very circumspect because what they are generally saying, from Dr. Anthony Fauci, who is kind of the top infectious disease doctor in the US and around the world, is that they're just saying that we do not know.
The data are really just at best suggestive
Okay.
So I think in terms of science, I don't think we could definitively say.
We're interested in this drug. There's a chance that this drug could have a positive impact, but whether or not it works and whether or not it's safe in this situation is simply unknown. And it's very difficult to counteract somebody who is expressing a lot of certainty and positivity in a very, frightening and uncertain time.
Have there been a lot of people who have tried to procure this drug since the media started talking about it?
Yes, very much so. As soon as Trump started talking about this drug, a lot of things changed. I mean, initially, India put in place export controls. Indian factories make most of the hydroxychloroquine in the world. So that immediately kind of created a shock to the market for it.
Pharmacists across the country say it's flying off the shelves.
We're seeing prescribers calling into pharmacies and trying to obtain mass quantities of hydroxychloroquine or plaquenil.
It's not an over-the-counter drug. You have to have a prescription. So it's not like people are going out and buying it up personally. But there were a lot of reports of physicians trying to stock up on it. And I mean, there have been health systems, hospitals, various doctors using it either as part of clinical trials or as what's called compassionate use, basically saying because there are no drugs known that can help, there are some doctors and medical systems which are saying we might as well use this because we don't have anything else to offer these patients besides, supportive care.
Inside this Texas City senior living facility, there's an incredible cluster of COVID-19 infected people. What they've got at the 135-bed nursing home called The Resort at Texas City is a life-threatening problem. And the attempt at a solution is either bold or reckless, depending on your perspective.
Don't you worry about the flip side if something were to go wrong?
No, certainly not a laboratory. These are old medications that have been around for some time.
What's happening here is a living, breathing, live human study using the malaria drug hydroxychloroquine.
I mean, that sounds crazy. So you can use this drug for coronavirus based on that compassionate care rule?
Yes. And that has created in many parts of the world a shortage. I mean, this drug is not commonly used for malaria anymore, but it is used by people who have these autoimmune diseases, lupus, rheumatic arthritis.
I was diagnosed with lupus in November 2017, and I was immediately prescribed hydroxychloroquine, also known as plaquenil.
Many of them in the US, in other countries in India, are now finding it almost impossible to get the drug that they rely on to live without pain and to have a certain standard of living, because this has been part of their general treatment for years.
It is a little disheartening to know that someone has medication sitting on their shelves as a just in case, when there are thousands of folks like me who definitely need it and who rely on it every day, and we can't get it.
Has anyone been hurt as a result of taking it, do we know?
Yes, they have. There was a couple in Arizona who reportedly, after hearing Trump recommend this drug, ended up taking a compound that they had in their house for aquarium cleaning that had a similar name, and that it's believed that they thought that it would be a prophylactic. And one of them actually died from the poisoning.
On ABC 15, we're hearing from friends of a Valley man who died after trying to self-medicate to protect against the coronavirus.
Gary and Wanda were best friends.
They were inseparable.
They were also scared about COVID-19. Wanda telling her friend Carrie Ann Monday morning,
"We thought we were going to get sick, so we took something."
Chloroquine phosphate. Similar but different than the prescription drug chloroquine, something they'd heard President Trump touting.
In Nigeria, there were 3 reported cases of overdose from people taking too much hydroxychloroquine, again, because they thought that it would protect them from contracting the coronavirus.
God, that is so sad.
Yeah, I mean, it's just
devastating.
Terrible.
And yesterday we actually heard from someone who claims they were treated with the drug for COVID. Rita Wilson, who's married to Tom Hanks, described what she experienced after she says she was given hydroxychloroquine.
And I know people have been talking about this drug, but the chloroquine had such extreme side effects. I was completely nauseous. and I had vertigo. I could not walk, and my muscles felt very weak. I think people have to be very considerate about that drug.
Obviously, these drugs can be very dangerous, but there are 2 physicians in Kansas who say they are treating their COVID-19 patients with this drug, and it's making a difference. You spoke to them. What did they tell you?
These are two physicians who actually wrote an op-ed piece for the Wall Street Journal promoting the hydroxychloroquine and azithromycin cocktail and saying that in the absence of other treatments that they were going to go ahead and use this.
You have to go to war with the weapons you have at the time. And we don't have any other weapons except social distancing and, great medical care, but we don't have a tool.
I reached out to them and I said, you've said again in this article that 100% of the patients in France were cured, and that is untrue. Do you want to correct that? I heard back from one of them, Dr. Daniel Hinthorn, and he's an infectious disease doctor, and he said that I was right, that there were concerns about this study. He also said that given that there are no drugs that are known to work, that for him, it made sense to at least try this one because it could give hope. But he did not agree or respond to me when I asked whether he might consider correcting this op-ed, which I thought really misstated what the facts are for this drug.
You mentioned hope, and I think that's the really interesting underlying theme in all of this, that, lots of people might be talking about promoting a drug that is not proven to be a cure for coronavirus, but ultimately that's all anyone in the world really hopes for at the moment, and hopes that we will be able to find one soon. Do you think that's the reason that Trump has been urging people to use hydroxychloroquine? Because he hopes it will work? Or are there other reasons?
I think the idea of hope is actually the main reason why this is being promoted so hard. There has been a lot of suspicion that somehow this is another situation where somebody stands to make a lot of money. The New York Times had a report about a week ago where they revealed that Trump has a small personal investment in one of the companies that manufactures hydroxychloroquine. And that was kind of taken by a lot of people as proof that this is a situation where Trump is looking for personal gain. I actually do not think that stands up to scrutiny. For one thing, it's a very, very small investment. More importantly, this is a generic drug that is made by many different manufacturers. However, we do have a situation where the richest country in the world, supposedly the most powerful country in the world, has managed to massively fail at protecting its citizens from this pandemic. I think everybody knows that. And so he is using, I think, the hope of a potential easy, accessible treatment, I believe it as a way to give people something else to think about and to give people something to distract them from thinking about why it is that we still don't have widespread testing and why it is that our healthcare system, such as it is buckling in cities like New York.
Julia, thank you very much.
Thank you so much.
That was Julia Carey-Wong. You can read her piece about hydroxychloroquine at theguardian.com, where you can also follow the work of our brilliant US team who are reporting on how coronavirus is unfolding in America. In response to this episode, James Todaro told us that he received his medical degree from Columbia University, an Ivy League medical school, and then did a 3-year residency in ophthalmology. He also told us that pinned to his Twitter account, @JamesTodaro_MD, is the most comprehensive compilation of evidence for and against hydroxychloroquine. This is a different document from the one Julia mentions in this episode. That document, which was shared by Elon Musk, is no longer available online. Today's episode was produced by Chika Ayres and sound design was by Ian Chambers. The executive producers are Phil Maynard and Nicole Jackson. Thanks for listening. We'll be back with you tomorrow.